Thanks so much, Liz. The presentation you're about to see now involves a short documentary which Danielle was courageous enough to make with our support. So we'd like to screen that first, and then Danielle will say a few words. Thank you. Please welcome Danielle.
Thank you. Firstly, I'd just like to acknowledge the traditional owners of the land on which we are meeting. I'd like to pay my respects to their elders, past and present. Look, I feel absolutely honoured and privileged to be standing here in front of you today. I accessed the NMHP service because I felt like I was drowning. After the passing of my father, I was stuck and just surviving. Dad always used to say to me, look, Danielle, as long as you are happy, I'm happy too. Your happiness is all that matters. But I wasn't happy. My self-worth and my self-acceptance didn't exist. I was overwhelmed by my busy mind, my internal chatter, constantly worried about what people thought of me and how they perceived me. Always worried about how they responded to me as well. I had these crazy, unrealistic expectations of myself, and I was self-sacrificing. I felt like I had to be a super nurse. I remember going into work one day, and that day I worked in a paediatric intensive care unit, and I remember looking after a patient who was critically unwell. And I was looking at this patient lying in front of me and saying to myself and saying to the patient, look, by the end of my shift, you are going to be better. By the end of my shift, you are going to be better. My expectations of myself and as a nurse were impossible. Look, I knew I had to change, and that was unbelievably scary. But I really needed to step back and reflect on my life and try and look at the path I was taking. I felt by working on myself physically, doing PT, eating better, and mentally becoming less fused with my thoughts and being less anxious and overwhelmed, I started to feel less exhausted, and I had time for what and who was important in my life. I started to build or rebuild connections that were important to me with my family, my mum, my nephews and nieces, my friends, and my dog Zoe. More importantly, by being more accepting of myself, I started to understand that the only person I could save was me. No one could do it for me. I honestly never thought I would nurse again. And after a 2-year break, I was able to get back to work. Now I've been able to get back to work. Now I've been back at work for over 2 years, and I've been able to continue to focus on what's important to me. I have the confidence in my own ability, and I think for me this was evident when I applied for a new position. I was interviewed by a panel of 3 people, and to tell you the truth, it was pretty bloody scary. But guess what? I got the job. If you had have told me over 2 years ago that I would be back at work and that I would be in a new position, I wouldn't have believed you. I appreciate the incredible support I've received from the NMHP, particularly Natalie, my friends, my workplace, and my mentors who have worked closely with me. And I really appreciate the wonderful connections I've been able to build with some amazing women from choir. I have to say though, without the help and the amazing support of my family, especially my mum, and the amazing little people in my life, my nephews and nieces, and my dog Zoe, as you can see, I don't think I would be standing here today. My journey so far has required a lot of mental strength and endurance, but I'm actually incredibly thankful for the difficult times because they make me appreciate the good times even more. I'm not just surviving anymore, I'm living. And I'm incredibly grateful for the wonderful support I've received from the amazing people in my life. One of the most valuable things I've ever been told was, Danielle, you are a human being first and a nurse second. I want you all to remember in tough times, when you are being challenged immensely, that the most important person is you. How can you be expected to be the amazing midwife or nurse you are if you aren't looking after yourself? There have been times of despair and hopelessness and darkness, thinking things will never improve, when in fact I'm living proof that things do and can get better. If I want you to walk away with anything today, it's to remember one of my favourite affirmations. Tough times don't last, but tough people do. And I think as nurses and midwives, we are living proof of that every day. Thank you so much for listening. I felt hopeless and isolated, a bit defeated as well. I was going through a lot of grief after my father had died and lots of relationship difficulties. I was in a really, really dark place. As a nurse, I was having a lot of difficulty with leaving my work at work. I was going home worried about how the shift went, or worried about how my patients were going.
Danielle came to us about 4 years ago, and it was in relation to personal struggles, professional struggles, connecting with community, feeling quite isolated, and I think that sense of losing hope.
I felt quite apprehensive and wasn't sure. I definitely had lots of trust issues. When arriving to the front door, it was Natalie that opened the door.
What you can expect when you come to the NMHP is to be greeted by a nurse that is qualified and skilled to be able to manage nurse-specific issues.
My anxiety eased a little bit because it did feel quite confidential.
Confidentiality can be a real question for a lot of nurses and midwives. So we are always very, very careful about making sure that everyone's confidentiality is protected here. So the NMHP was created to provide sensitive and compassionate support to our nursing and midwifery colleagues.
I don't really think friends and family, unless they're nurses or midwives themselves, understand where you are coming from. And I don't think they understand the intensity and pressure that you are under as a nurse. It was definitely a relief to know that there was someone that I could connect well with and quite warm and welcoming to.
The NMHP has a philosophy that works on the assumption that people have the skills to be able to manage their life, and they may have just gone off track and they might need some support to get back on track. So we have a model of strength-based case management.
Natalie encouraged me to, start living my life again, which I'm really grateful for, because I felt like I wasn't living much at all. So it was nice to be able to come to a safe place and have someone to talk to. Initially, it was just setting up small goals for me to achieve, getting back into exercise. I've got a personal trainer who's pretty awesome, and I see her usually once a week.
From then till now, it's just, it's a completely different person. The main thing is that her self-esteem has just done a backflip.
It sort of made me tick a box, like I could walk away and say, I have achieved something today, and I was really, really happy that I actually did go and start something with her. Zoe, my dog, when I was going through a difficult time, she was the one that sort of helped me get out of bed.
So the dog training was really about taking that significant thing in somebody's life, whether it's a partner, a family member, a pet, and developing the relationship. The choir was a really big thing because it was 2 years in the making. She went on a 2-year waiting list to join the Brunswick Women's Choir. So she joined the choir, she felt really connected, so it's all women, it's a really safe place again, an opportunity to build resilience, to feel safe, to gain strength.
What I love about singing is that when I'm singing, I don't feel like I'm in any pain. Being surrounded by other women who are inspirational and vibrant and enthusiastic and passionate, and I think that's what's so wonderful about choir.
The most rewarding thing about working at the NMHP is the privilege to support people who often feel as though there's no answers or no direction that they can take. And for when they've been here, being able to influence that and for them to understand when they've had the experience of working with us that they in fact have answers and there is a direction they can take.
I'm excited about what the future is offering for me. I'm in charge now.
As nurses, we do support our own with empathy, understanding and without judgment. If you're feeling apprehensive or concerned about making contact with us, I would just encourage you just to make the first phone call. And you might be surprised just how easy it is and how welcoming and how understanding we are here.
That's what the NMHP is here for. Pick up the phone and call us.